So as you emerge out of lockdown, how is your health? Have you brought in any self-care? How are you actually looking after yourself? And do you feel that you might need a little bit of support? So we're going to be listening to Dr. Rizwhan now. So Dr. Rizwhan is a hijama and cupping therapy specialist with various clinics and also expanding at the moment. And the therapy itself, he works with elite athletes, world heavyweight boxing champions, Premier League football players and international athletes, as well as the local community. And in his own words, the treatments are to optimize health, enhance recovery, avoid injury, and they are a completely a mind, body and spirit experience. So, welcome, Dr. Rizwhan.
Hi, how are you, Sunita?
Hi, I'm good, thank you. How are you?
I'm doing great, thank you. And thank you for having me on.
Oh, delighted and excited to hear about your services. So for those who haven't experienced hijama or cupping before, how does it actually alleviate mental, emotional, spiritual problems? How can it help us?
Well, I think to answer that question, first of all, those of you who don't know what hijama or cupping is like it's a suction that you apply on the surface of the skin, and it leaves these round marks. You might have seen kind of athletes and people have it. But if you haven't, go and look it up. There's lots of resources out there to show you what it is. But obviously, it's a very physical thing. It involves, it's kind of you can consider it a form of a manual therapy, effectively. And there is a form that involves kind of bleeding as well. So it involves a little bit of bloodletting, which sounds a little bit gruesome, but it's not as bad as it sounds. So yeah, it's quite a physical thing. But as most people will and should hopefully understand, that there's a huge connection between our physical, our spiritual, mental, and social structure. So these things are all kind of intertwined. So, the way you feel physically, what you get up to physically, your activities, your habits, they all have an effect on you mentally, physically, spiritually, emotionally. So they're all kind of intertwined. So the therapies that we use are influencing health from various aspects, but undoubtedly they have wider effects on the whole being. And this is why we consider our practice to be a holistic thing. When you maybe you go to the GP or you have, let's say, a problem somewhere, let's say you have an ankle pain or something like that, usually the focus is just focus on the pain and how can we help you get out of it. There's no consideration as to, how is this affecting you in terms of your life, how have your habits changed, what are you getting up to, all those kind of different connections really are missed. So what we do is kind of integrative, effectively.
Yeah, so it's a 360-degree approach, it sounds. You're looking at all the different aspects of somebody's life and actually how that might be causing the issue. So you work with clients, you work with patients, and you develop specific healthcare programs for them. So again, this is quite different to if we rock up and we see our GP, where we've got 3 minutes basically to to tell them what's going on. So you have more of an intimate relationship, with your clients and patients. So how do you actually develop healthcare programs for them? Do I come in and have one session with you, or do we sit down, we have a 45-minute chat, and then you put something together? How does it actually work?
So to answer that, I would say, first of all, it's important to understand that any healthcare practitioner, whether they're your GP or whether they are an alternative practitioner or whatever they are, whatever they do, ultimately the job of a doctor or even the term doctor, the deep meaning or the root meaning of it is a teacher. So they need to help teach you and educate you on your health. And obviously, we're all aiming to do that. But in our organization, one of the things we do is we teach people how to become alternative practitioners and learn about these things. But one of the principles that I often teach, and one of the ones that I emphasize to all of our practitioners, and this isn't just about practitioners, this is a lesson in life, effectively, is that you should first seek to understand, then seek to be understood. So we apply this in our practice with patients. So the first thing I need to do is I need to make sure that I understand the person. Now, sometimes, realistically, it's very hard to do that in 3 minutes. So yeah, when I do meet a patient initially, we spend a good amount of time where we go through a very detailed health assessment, understanding them, physically in terms of how their body's functioning, mentally in terms of, where they are and what's been going on in their life, who they live with. We ask all sorts of questions. Sometimes people raise an eyebrow when we ask them some of the questions because they're thinking, especially if they're Asian, they're like, why do you want to know that? Do you know my auntie or something like that?
Yes, are you being nosy? Yeah.
yeah, exactly. So, and I always, I remember actually I had one patient who was a lady from the Caribbean originally, actually, and she was like, why are you asking me these questions? My doctor doesn't even ask me these questions. And she was a little bit offended by it. But the idea is to understand. We have a good understanding of you. And not only if we have a good understanding of you, if you feel understood, then when I give you advice and when we talk heart to heart and I say, look, I understand your situation. Maybe you've gone through a bereavement. Maybe you went through a breakup. Maybe there was a difficulty that you've had in your life. Or just even to say, as I give an example of an ankle pain, you could say, well, wow, you must be things must be really hard for you because you're not, getting out and playing football as much as you used to. How's that affected you? How are you coping with that?
Dr. Rizwhan, so statistics show that people are more mindful about practicing self-care post the pandemic. So why do you think the shift? Why do you think it took a pandemic to see that shift?
I think one of the things is probably to do with the services that are available. Obviously, everyone's, even now, I think people are not getting in to see their GPs and not getting the responses from the system as quickly as they could, and maybe not getting even the services that they really need as quickly as possible. So one of the things is that people have to, they've kind of got no choice. Maybe it's a mind thing. They're thinking, well, I don't want to go in and disturb or put pressure on the system, for example, or maybe they're just not getting the access. So one of the reasons is that they kind of have to. People are dealing with lots of issues, physical, mental as well. Unfortunately, we've had people that we know that have, had struggled really bad. And we've even quite recently had someone who, took their own life, as a result of the difficulties that they've been having going through the pandemic and potentially not getting the care that they need. So one thing is obviously that, people are, struggling to access services. And I think the other thing is that, people are being constantly, reminded and, maybe in some ways have been kind of put into fear in relation to their health.
Yes.
So obviously a bit more conscious of it. So they're taking more care of it, which is really in some sense, as you said, why is it taking the pandemic to do that? But I think culturally we have a shift in things, in the way that we're understanding things. Previously, I would say that we had a very bad approach where we almost outsource our health and we say, well, my GP is responsible for my health and, I'll wait for them to get back to me on my results, or when they tell me to do something, then I'll change. Rather than now having a proactive approach, definitely there's something positive out of it because people are taking health into their own hands, making their own choices and judgments and thinking about things. So generally, I think, just more that awareness and consciousness is definitely there.
So it's a good move, especially if people are seeking out more guidance and support for practicing self-care and how to practice self-care. So how do you? I understand the treatment programs. How do you actually help them with their self-care? Do you give guidance of things that they can do at home that they can practice? Give them tools? How do you achieve this?
100%. So our clinic and what we found, the foundations of what we're based on is creating, it's lifestyle medicine, creating change within each individual by helping them understand things differently, implement new changes and improve. Even if people have, let's say, a back problem or, some issues that they're having, if we help them, then we always, I always say to patients, there's nothing that I'm doing with you in the clinic that you can't do to some degree yourself at home. And the idea is to give them and equip them with the tools to actually help themselves, whether it be using self-exercise techniques, self-release, self-therapy techniques, whether it be making changes to their diet and educating themselves. So the key really is to educate themselves in the ways to help themselves. And that's what we've done always, even before pandemic. We've always had that approach. And I think, to be honest, that's one of the reasons why I think we're quite popular in what we do, is because people feel empowered. And we don't like to make people reliant on our services.
Yes, yeah. Well, I mean, I also, from my work outside of the studio, it's very much, if we can teach people to be their own healer, their own practitioner, then we're moving people forward, as it were. So you've got great news. You're expanding. And you've opened up a new clinic. So this is great. So it shows that more people are seeking out services such as yours. So tell us about that. Tell us about the new clinic and really where you see the future of hijama and cupping therapy.
So we've just opened our clinic in Bristol, near Temple Meads in Bristol. And obviously we have our main site, which is in Leicester, and we also have a clinic based in Cardiff as well. So yeah, we are definitely expanding in that sense, and the demand has always been there. We've always had calls to kind of open more clinics in different places and have more accessibility to what we do. But the recent kind of climate has kind of allowed us, I think, just to take those opportunities and kind of meet the need really that's out there. So we've expanded our team quite significantly. We've got quite a few different practitioners who are working with us, and we're obviously offering the service in Bristol. It's going great. The response has been excellent down here in Bristol. We are still busy as ever in our clinic in Leicester, and we're still obviously serving there. And I'm, to be honest, even though I'm in Bristol, I still work the majority of my time in Leicester.
Yes.
So I'm kind of back and forth. Doing a lot of travelling myself as well.
Okay, so the nearest clinic to the audience would be Leicester. So it's the ICAHT clinic. And do remind me, what's the website?
Website is icaht.co.uk. Or you can just simply, if you Google hijama in Leicester or on YouTube, I'm sure you'll come across one of our videos.
Wonderful. Thank you so much.